Careblazer, for many people, they may not ever get a diagnosis of dementia, or the actual process of getting a diagnosis of dementia is delayed months or even years. In this video, I want to talk about 3 common reasons this might happen, and it's good to understand these reasons and understand that for many people, the diagnosis is delayed or doesn't come, because it can allow you to better advocate for your loved one, where you can actually go to the provider and let them know, like, I know something is going on. I know something just isn't right, and I would really love a thorough, comprehensive evaluation to make that happen. So I'll go over the 3 reasons. I'll go over how you can advocate for your loved one if you find yourself in this position. And if you do find yourself in this position, you are certainly not alone. Now, it's important to know that this video is not about advocating for a dementia diagnosis. I don't think anybody truly wants a dementia diagnosis, but it's advocating for your loved one to get the right evaluation to figure out what's going on and what can help, because there could be another condition that's causing the thinking problems, that's causing the behavioral symptoms that you're seeing. There are many different dementia lookalikes that can present like dementia, but might not be dementia at all, and they're totally treatable. And so we want to figure that out whenever we know, as the caregiver, something is not right here. Okay, so what are the common reasons why a dementia diagnosis might be delayed? The very first one is that they are of a young age. And when I mean young age, I mean below the age of 65. Okay, so most cases of dementia happen in individuals who are 65 years old and older. So whenever somebody is younger than 65 years old, they could still have dementia, but for them, the process of getting the diagnosis is often delayed. Now, the diagnosis of the condition of dementia, it is only given after everything else is ruled out. That's true for anybody of any age. It's considered a diagnosis of exclusion, meaning everything else has been excluded. So when somebody who's not of the typical age for dementia presents to the healthcare practitioner, they are definitely considering all kinds of other things before they would consider dementia. Because of that, younger people who have this condition usually have a longer time to wait before they're given the diagnosis, or before the healthcare provider and the healthcare team comes to the conclusion that this is in fact dementia. Reason number 2 why a diagnosis is often delayed is because the person doesn't have any memory impairment. So in this situation, the person presents with really great memory, and memory is not a requirement to have dementia. In fact, you can have totally great memory and still have dementia. So a lot of times the initial contact when you're trying to get a dementia diagnosis, or I should more clearly state, you're trying to figure out what's going on with your loved one's thinking, you're often going to go to a primary care provider, and they might do a very quick screener. It's usually 30 questions, and they might give your loved one 3 words to remember. And when your loved one remembers those 3 words, or seems to remember the healthcare provider, it could be easy for that healthcare provider to think they don't have dementia, because, like I've also mentioned before, most healthcare providers don't have any specialty training in dementia. In fact, some healthcare providers, many of them, I would argue, don't even realize that memory can be totally fine and you could still have a dementia diagnosis. There are actually 6 different cognitive domains, otherwise known as thinking areas. There's 6 different thinking areas that are evaluated when we're looking at dementia. And only one of those areas has to meet impairment in order to meet that part of the dementia criteria to have the diagnosis. So somebody could have perfectly fine memory and they have one of these other 6 areas impaired that could qualify them for a dementia diagnosis. So if all the healthcare provider did was ask them to remember 3 words or give them a short little 30-question questionnaire and they did fine, it doesn't mean they don't have dementia. And that's where a more comprehensive, thorough evaluation comes into play. And just as another plug here, anytime somebody is given that little 30-question item screening, that's never intended to diagnose dementia. That's just intended to screen and see if somebody needs to be further evaluated. Okay, on to reason number 3 why a dementia diagnosis might be delayed for someone. Careblazer, my phone ran out of storage space, so I had to switch over to my computer. So here I am now to finish this video. Okay, so remember how memory is only one of 6 cognitive domains that are looked at whenever a diagnosis of dementia is being considered. One of the other areas is language abilities. And so think about this. Think about your loved one going into a healthcare provider's office and they're able to have a conversation. They're able to understand what the healthcare provider is saying. They're able to follow along in the conversation. It's pretty easy in a short appointment to look like everything's okay when the language abilities are okay because they're following along. And so similar to reason number 2, when somebody's language abilities are pretty intact, it's really easy during that short visit to look like everything's okay. And so then that might also be a reason the diagnosis is delayed because the healthcare provider might be thinking whatever you are expressing your concerns about, the healthcare provider might be quicker to come to the conclusion that it must be normal for their age or there's really nothing to worry about because they seem so fine during that short appointment. In fact, have you ever had this experience where you go to the healthcare provider, you bring your loved one there, and your loved one seemed totally fine during that short appointment? Have you ever had that happen? I am guessing for many of you, the answer is yes. You can leave it in a comment below so everybody can see how common this occurrence is. And when the healthcare provider is only relying on that brief snapshot of how the person looks in front of them, you might have to advocate even further to get more comprehensive testing. Here's the big takeaway. If you truly have concerns about your loved one's thinking and you know something is happening, even though during the appointment they seem fine and the healthcare provider might be thinking this must be normal for their age, you could actually ask for a more thorough evaluation. You could ask for a referral to a neurologist or to a neuropsychologist for further evaluation to see what is really happening. Again, this isn't to advocate for a diagnosis. We're not trying to get more people diagnosed with dementia, but we are wanting to make sure that if something is causing some strange symptoms you're noticing at home or something is causing some brain fuzziness or unclear thinking, we want to figure out what is actually going on so that if we could treat it, we want to treat it. So now I'm curious, how long do you estimate it took from the moment you realized something was off with your loved one? How long did it take before you actually got an official dementia diagnosis, right? And a dementia diagnosis includes things like Alzheimer's disease, Lewy body dementia, frontotemporal dementia, vascular dementia, all these different kinds, right? How long do you think that timeline was? I'd be really curious. Put it in the comments below. We could see how long everybody was waiting. Or are you one of the many caregivers who reach out to me and let me know that you still do not have a diagnosis, even though you are sure your loved one must meet the criteria? You are not alone if that is you as well. Now, you might be wondering, why in the world would somebody even want a dementia diagnosis? Why would somebody want to advocate for them to go get this testing? That's a really great question. And I will give you multiple reasons in next week's video about when a dementia diagnosis is given, how that might be able to help you and your loved one in the future. So if you don't have the bell icon turned on, you can click the little bell icon on your screen and you'll get a notification when that video is ready. And if you want a more in-depth training on how to care for somebody with dementia without the overwhelm, dread, and confusion that so often happens, there is a free training you can sign up for. It's more in-depth and the link is in the description below. Sending you love. Keep up the great work. Also, Nico gets a belly rub for every person who subscribes from this video. So if you haven't already, click the red subscribe button. It's totally free. And Nico says, thank you very much.